This episode is brought to you by Banfield Pet Hospital and proudly sponsored by our friends at Zoetis, whose team of pet lovers, scientists, veterinarians, and more have dedicated over 70 years to advancing pet health.
Hi, Hannah. This is Sabrina from Minneapolis. I have a question about my cat, Luna. She seems totally fine, super active, eats well, no issues, and I've always kind of waited to go to the vet until I notice something's wrong, but I keep hearing that regular checkups are important, even when the pet seems healthy. Can you help me understand why that is? Thanks.
We all know to take our animals to the vet when something is clearly wrong. But what about when things seem fine? Today, we're talking about the power of preventive care, why those regular appointments matter, and how building an ongoing relationship with a veterinarian can put you in a better position to give your cat or dog a healthy, happy life. I'm joined by Dr. Kimberly Riley, Director of Veterinary Quality at Banfield Pet Hospital, who knows firsthand why regular checkups are about so much more than a quick look over. From catching the sneaky health issues before they get serious, to reducing stress around vet visits, to even saving money through early detection, Dr. Riley shares how routine care can make all the difference in an animal's health and in your peace of mind. Dr. Kim, welcome to Not Just Fluff.
Thank you for having me.
So, you knew from a young age that veterinary medicine was your calling. I would love to hear more about that. What experiences did you have when you were young that led you to know that you wanted to pursue a career in veterinary medicine?
We lived in kind of a suburban setting, but I'm one generation removed from farming. So I enjoyed going to my grandparents' house, very immersed in nature. And one of the things that now that I'm older, I'll say it grounded me, but then it was relaxing. It was fun. It made me curious, was spending time with the barn cats or the dogs that were around. I don't know, it was probably like 3 or 4 maybe. I got to pick out one of the barn cat's kittens, and that was my first time as a pet owner. So, her name was Kelly. She was this lovely tabby cat, and I just felt a sense of she's mine and would spend hours with her outside or, playing and doing all of the things, and so, once I found out a couple years later that that's a thing, that you can um, have a professional link to this. Like I can, not necessarily pet them and love them for a living, but be adjacent to that love and that passion. Then I knew immediately that's what I want to do.
That's a beautiful story. I love that. Do you have any animals at home now?
He's 65 pounds, standard poodle. But his name is Chase, and he's my senior citizen. He's about 12 years old. So I have 2 boys. They've only really known life growing up with Chase. So he's a year younger than my youngest.
So I want to hop into our conversation. I think when a lot of people are going to the vet for the first time, they might assume it's going to be kind of like a transaction, right? They go in, they have the vet appointment, they leave, and that's maybe the only time they expect they'll see that person. But vet care can be really a relationship that grows with the client and the animal and the veterinarian. When you're doing that routine care and you're growing that relationship, what does that mean for you in terms of, the type of care that you're able to provide for people who are coming in on a routine basis?
Yeah, what I love about that is, the opportunity to build trust, and, I think of some of the things that impact the extent to which I'm able to be a decent vet, a good vet, and a great vet, and having a relationship, being able to, have history with that family and the pet that they're caring for, being able to say, "I remember this," or, "We know this is normal for him," or, I'm concerned, and I think we really need to investigate." You're leveraging trust that gets built in those more regular, mundane routine care type visits. And so I think that's probably one of the greatest values that I see in those moments.
I work with a couple of different veterinarians for my various animals in my house, and the trust that I have developed with them over the years, it's just really profound. But that doesn't start right away. So, do you have any examples of kind of a case that you have worked on where you've built trust over time and you've gotten that buy-in from the person to really help be able to provide the best care for the animal?
One moment that just, I think really touched me. I had been taking care of this small dog named Wesley for years and gotten to know the family pretty well to the point of where, we're asking after each other's loved ones and things like that, in
Mm,
addition to, partnering to take care of Wesley. But one day he came in not feeling well. And I was concerned, like something on the exam and in the history, it just kind of like, got my senses alerted. And I think he was having some GI issues, if I remember accurately. Um, but I put together a treatment plan, and my routine is to discuss what I'd like to do diagnostically, what I'm concerned about, what am I looking for. Um, and then I will discuss the logistics with him. How long do I need for this? What does the cost look like? And I just remember beginning to say, like, I want to explain to you some things that I want to do diagnostically and what I'm looking for. And she just stopped me and was like, Dr. Riley, all I need to hear is that you are concerned and you want to do it. So I just want to move forward. And to me, that was 100% trust, for me to create and implement a diagnostic plan. And of course I was kind of like, but I insist, I want you to know, not because I thought there were going to be concerns, but I see my client as a
sure.
partner. And if I know what
Mhm.
I'm looking for, I want you to know what I'm looking for as we embark on it. But it was one of those moments where I thought, like, this is where the payoff of us building a relationship across time, me saying, you need to do this for Wesley on some days, and them disclosing, I fed this, is it okay? Like those types of things happen. So I felt like that now in that moment where it really, really counts, we are leveraging a really good trusting relationship.
A lot of that builds in those maybe more mundane wellness visits. And I would love to hear you talk about those wellness visits because I think a lot of people do wait until their animal is quite sick and then they're coming in and maybe working with a veterinarian that they don't have that relationship with. When you're doing a wellness visit, for the person bringing their animal in, it might look like you're just doing you're just doing a once over look at them. But what are you actually doing? Talk about the value of what happens during those wellness exams.
We start with what we call the history. So this is where even the team is highly involved in this part, and you might talk to a couple of different people before you talk to the vet. And we're just trying to understand, gain insights to the life that your pet is living, things that you are concerned about, things that we want to raise as a concern that we won't find on our exam, just based on getting to know, again, the life that your pet is living. So we start with a history, and we're learning about their needs and what the concerns are. Because even at a well visit, there can be concerns. And then we are going to do our physical exam, and we're taught from the rooter to the tutor, like, or whatever cute saying, nose to tail, but we want to be thorough. We're not going to just do a quick listen. And I think we've all had those exams where the doctor is like, oh yeah, grabs the stethoscope and does a quick listen on us, but we've also kind of voiced what we're feeling, and a lot of things. So we recognize that we really have to let the body talk. So we do a complete physical exam, looking inside the eyes, the nose, the ears, the mouth, and palpating and feeling glands and different areas. And of course, we do want to listen to the heart and the lungs and feel their belly. Not uncommon, like, a rectal exam. It sounds unpleasant, but it's usually very quick and painless, but it can be a really important part of your pet's wellness exam. They got a lot of activity going on back there, and so there are some things that very important for us to check out. We check their vitals, and a lot of us, my favorite part of the well visit is doing some lab work. So we'll probably collect some samples. And talking with my clients, I'm like, this is kind of similar to when we go in and out of the gate, they're send you a specimen cup into the restroom, or they're going to check your blood pressure and your weight. So this is a really important part of us gathering some of the data additionally from the body. So based on that, then we kind of talk about any recommendations that we might have. And a lot of that, is where we shift from assessing or, gathering information to turning that into an assessment and making some recommendations to help keep your pet healthy until they're due for their next checkup.
Hmm. I think that with these wellness visits, prevention is a huge thing that comes to mind. We want to prevent things from getting worse than they are now, and I think sometimes we can get more buy-in from people when they understand what exactly are we trying to prevent here. So when someone's bringing you a cat or dog who seems perfectly healthy and you're recommending all this stuff for them, what are you trying to prevent, and how do you have those conversations to get that buy-in from somebody who's thinking, I don't know, they look fine to me?
So we might see if a dog is like jumping up for treats and to greet, but they're a little bit limited, then that's an example of what I mean, where maybe you don't have major concerns. They're doing okay, but something is affecting their quality of life from being fully maximized. And so we don't only want to prevent diseases, we want to prevent some of those things that limit play, um, might come between the bond that they share with their family that is caring for them. And so it's all things big and small that we can make a positive impact.
When I think about my animals, I don't know that everybody thinks the same way about their animals' dental care. Can you talk about, like, should people be doing something preventively for their dogs or their cats?
So small breed dogs, for example, um, tend to be plagued a little bit more with periodontal disease and some of those things that can cause tooth loss and just discomfort. So I think for them, early and often is that much more important. But by that same token, a larger dog who's very playful, very active, might be more inclined to have an injury or a trauma to the tooth. So even they need regular dental care, and a good oral exam. Doing a good oral exam, we can get a look when they're awake. And most of our patients are willing to let us do that for a moment. But doing a really good oral exam happens under sedation or under anesthesia. So, very similar to how we go in and get that cleaning every 6 months, and being a little bit late, or the longer you wait, the later you start doing these things, the more we're going to need to do in there. So starting early, I would encourage folks to like talk to your vet about what are some of the things you can do between those cleanings, because there are a lot of products, sometimes foods that are aimed at helping to maintain their oral health between those professional cleanings and the oral exams.
Yeah. When I think about dental health, I think how uncomfortable it is to have oral pain, and we can speak up about it, but they can't. So I think those routine exams are so important for that reason. And I I adopted a little Chihuahua this year who was given up, and we don't know why he was given up, but I have a guess, which is his mouth just smelled like a fish market. You could smell him from across the house, and I brought him in, and unfortunately his dental disease was so advanced that he had to have all of his teeth removed. So he's one of these little guys that has his tongue hanging out 100% of the time. And I wonder, would he have been able to stay with his previous household if he had had dental care? You know, how often do you see dental disease get that advanced? And what role would prevention have in kind of warding some of that off, or is it inevitable for some animals?
We don't want to wait until there is disease to start taking
Hmm.
care of the teeth. And then also again, like what can you do at home that fits your lifestyle and what your pet will tolerate. Um but I hope that we're getting better to where we're going to start to see those kind of salvage procedures much less common, and much more common is where we are focusing on scaling and polishing, being proactive, referring to the dental specialist where necessary, because it is ideal that they get to keep their teeth and that they're comfortable with
Hmm.
them for as long as possible.
I think one reason that people might avoid going to the vet is they might be concerned about cost. Budget can be a concern for people. How do you talk to caregivers and help them prioritize what care they need, what's essential, and maybe what they don't need right now?
Again, I see clients as our partners. We are the medical professionals, and they are the expert on their particular pet and the life that they're living. And so, there are some things that are just considered core and kind of standard. And we really do focus on educating on those things. And, um, you know, core vaccines, for example, um, parasite control, those are really basic needs. And then some other things might be driven based upon lifestyle, where you live, some of those other things. And so I think it's really important for us and for clients to know, like, for folks going in to see their vet, it's totally normal to express that you need help prioritizing, particularly
Hmm.
when um, either cultural or preferences are driving some of your decisions, or when finances are going to drive some of your decision. So we want to help you prioritize, and sometimes we might do that. Um, with a strong nudge. I want my clients to know that a rabies is required by law, and what may happen if their pet's rabies status, their vaccine status is questioned and they're not vaccinated. Like, there's some pretty serious complications or implications for letting that lapse. And then they're going to be able to make an informed decision. But like a transparent conversation where you can let me know where you're needing help setting priorities for any of those reasons. Um, and I think that it's always important to remember that education and getting your options is a part of the consultation that you're there for. So, it's good to hear them out, even if you need to think about it or set priorities and come back for some of that care at a future date.
How do you help people decide, like, should they be saving up for the future if there's something big that happens, or should they be, you know, prioritizing the wellness visits? Do you see that it might actually be more cost effective to prevent rather than to wait until they are sick?
I don't think it's a wise decision to say, I'm going to save up in case my pet gets sick, and say no thank you to wellness services and prevention, because you're going to save up for when an illness happens. And using heartworm prevention as an example, if you bank that money in case your pet gets sick and you live in an environment with ample mosquitoes, which most of us do, then you're going to probably spend more and also compromise your pet's health to some degree, because they can't have heartworms and be completely free of consequence to their heart or their health in some manner. Um, Also, you can spend in treating heartworms. You could spend as much as it costs to prevent it across their lifetime. So I do think while it's nice to have a rainy day fund, it's very much worth investing in your pet's wellness when you're taking them in for an appointment and navigating those decisions.
It's a great example. And I think when a lot of people consider prevention, thinking about things like flea prevention, maybe they go to the store and pick something off the shelf and that's their approach. But you'll notice when you go to the vet, there's so many other options for prevention that are prescription or that can be recommended by your vet. Can you talk about the difference between, picking something off of a shelf versus going into the vet, and what's the difference in products, and is that something that you would recommend?
There are a lot of things that are over the counter that may be appropriate for some things in some circumstances. So, if my dog chases a bee and he has an allergic reaction, part of what we're going to do is Benadryl, and at some point I'm going to switch to the oral form, and it's, we yes, we can prescribe it, but is it the same Benadryl that's over the counter? So with shopping over the counter for flea medicine or things that are more broadly, your vet can help you even just be a smarter consumer. So if it's appropriate or there's an option for you, let your vet point you in the right direction for what those options are. Flea prevention, particularly, I can say a lot of us are just not happy with the efficacy or the circumstances that they work or how long they work. And so we will, spoiler alert, we will probably recommend some of the prescription flea medication. But when you need help in navigating some of those over the counter options, your vet is still a good resource if there, might be a category of medicine or product where that is actually a good option. So, still, I think it starts with the conversation and the consultation with your vet.
Hmm. One thing that I'm always looking to prevent, that maybe is paradoxical, is I'm always looking to prevent the stress that can be associated with taking my animals to the vet because, I have a couple cats who just howl in the car or, vomit in the car or are not very nice when they get to the vet because they're like, I don't know you. I don't want to be here. And I don't want to let that stress prevent them from seeing the vet. So I have really found it to be wonderful to partner with my vet on having medication that can help mitigate some of that stress. But you do have to have that. Like, that's not something I can just go buy off of the counter. So can you talk about, stress prevention and medication and how you manage that with some of your clients and their animals?
Yeah, I mean, and you're right. A lot of the things that are going to be very effective at making that journey to the vet doable, less stressful, um, less bodily fluids, all that kind of stuff. A lot of those are going to require a prescription. So
Yeah.
once you have that initial consultation with your vet, if you already have concerns or if it's a buildup over several visits, then we want to know about some of the hard parts of getting your pet in. So I love the idea of just, kind of asking the vet about that. But we can give things that you can administer prior to coming in for the visit. We sometimes might change um, how and um, where we examine that patient. And, some are going to do great if they're with their pet owner, and others are feeling very protective and they're
Mm.
worried about you. And when we take them away to another room, they're snacking treats, they're, showing us their tricks, they're having a good time, they're more relaxed. So we do want to partner with our clients to find like what's going to reduce some of those anxieties.
And so I'm curious if you can talk about kind of how often people should be bringing them in if they are, seemingly in good health. How often are you recommending that these checkups do happen? And does that vary for you based on, the lifestyle, the age, the breed, the species?
So the rule of thumb, every 6 months, when we're in that young healthy adult stage of life, that's the frequency that I want to see my patients for, just a general checkup. But the very young and the elderly, we're probably going to start to customize that a little bit more, and there'll probably be more frequency.
Yeah. And I think we all hope that once somebody has adopted or brought home a new animal that they're doing these routine appointments. But if there's somebody listening who's going, "Wow, I've had my animal for 4 years and they've seemed healthy, so I haven't brought them in." Um, talk about, like, is it ever too late to start prevention? I think I know the answer, but if somebody's getting a late start, what might that look like for them if they're, just starting to do these types of appointments?
Yeah, never too late. And also we welcome that. So, there's an opportunity there and we want to see those pets come in. Um, but there's not judgment, certainly not on my part. And I think our profession and the teams that support us, we celebrate that moment when there's a cat that's not come in for several years, and a lot of time it is a cat because they're very quiet about anything. They hide illness very well. So it's like I'm human, life is happening, and so we relate. And we will certainly just, meet you where you are, and make recommendations to stay on track. Or if we find something to address, then I'd rather we catch it after a few years, not having been to the vet, than to wait until it is much more advanced. So, never too late for prevention, and getting a clean bill of health is also not a wasted investment of time and resources.
Totally. I love your non-judgmental approach because I think a lot of people are ashamed of, like, "Oh gosh, when was the last time I saw a vet?" Or maybe they've never gone and seen a vet. So for anybody listening who's in that situation, like, what is one step that you would say they could take today to start moving towards a healthier life?
Make an appointment, even if your pet's not having any issues that you feel like you're concerned about. Um, Maybe as best as you know, they're current on their care, but you don't have necessarily that trusting relationship, that established relationship that we talked about. Just schedule a consultation, and I think that's a really good place to start. The other thing I'll say is when you go in, don't be afraid to overshare or to over ask. It's what I do with the people that I get this from being a veterinarian. When I go to my doctors, I'm telling them the down and the dirty and all the things, and I will tell them the TMI. I'll ask the questions, um, and it's because I feel like, wow, we're doing a good job when I see a pet and the client is asking me all their questions. They're disclosing things that maybe they shouldn't have done or might be embarrassing. Those are all of the things that we want to know so that we can help them with. So yeah, I think a good place to start is just to meet and greet a vet and get an appointment set up for your pet.
I love that. And it goes right back to the beginning of our discussion that it's about building that trust. And, I think that that helps you really act as a team. So before we wrap up, I want to play a round of quick pause. This is where I'm going to ask you some rapid fire questions, and you are going to respond with the first thing that comes to mind. Are you ready?
Sure.
My first question, this one's fun. I'm excited to hear your answer. Is what is a photo that you have in your phone as a veterinarian that other people would think is really weird?
I do have a picture of a dog butt that looked like a face. It had like a certain hair pattern. So yeah. I think cat butts are the cutest, but this dog butt was kind of special.
We might have if you work in the animal welfare industry, you might have a disproportionate amount of animal butt photos in your phone. Okay, the next question is, what is an animal name of a client you've served that you've never forgotten?
This what they said the kid named it, because I'm like, "Where do you come up with that?" But there was one named Tony Bitty. Um, just like it was the cutest name, and I'm like, I just don't think I could have come up with that. The other one is actually my brother's cat from childhood, was named Oscar Squatch. And again, like, what even is that? So it's always been one of my favorite names, and I have no explanation for it.
Okay, the next question is if you could treat any cat or dog, real or fictional, who would they be? So I'm thinking like cartoon characters like Scooby Doo, the Aristocats. Is there a fictional or real cat or dog that you don't know that you would love to treat?
Maybe Tom from Tom and Jerry.
Oh yeah, why? I mean, he probably he's exposed to rodents. He seems to have high energy. There's probably a lot going on for that guy.
Yeah, exactly. I think he's gonna have a really interesting fecal for his parasite screening. You're gonna see some fun stuff under the microscope with Tom. I also think he's cute and just I like a naughty cat.
Oh, great. You should be my vet. I have a couple of those. That's so funny doing a fecal screening for a cartoon character. I'd love to see it too. All right, my last question is what is a myth about animal health that you wish would disappear forever?
I don't think it's like 100% a myth, but I think a lot of times people don't see or don't recognize or don't believe when we try to highlight that there is pain. So, and I guess like what is probably a myth is like if they're eating, they're okay. If they're wagging their tail when I come to them, they're okay. And there can be significant hindrance on their quality of life. There can be significant pain, and they're still eating, they're still wagging their tail and acting happy to see you. So, um, I think that would be definitely my number one myth I would like to see completely busted.
Well, thank you so much for your time. I have loved this conversation with you, and I really appreciate all the great work that you do for animals.
Thank you so much.
I loved this conversation with Dr. Kimberly Riley. So many great reminders that veterinary care is not just about fixing problems, it's also about preventing them from starting to begin with. If it's been a while since your last appointment, it's okay. Don't be too hard on yourself. Just take the next step, reach out, and get on the schedule. Your cat or dog will thank you, and so will your future self. Thanks for listening to Not Just Fluff, and I'll see you next time.